Planet Vero Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
And good afternoon and welcome to Community Conversations. My name is Vicki Soule and I'm the CEO of Treasure Coast Community Health. For those of you that are aware of our function in the community, we try our very best to provide one-stop shopping, primary care and medical, whether it's children or adults, behavioral health, pharmacy, x-ray, dental services, even behavioral health, and some assistance with those that have substance use disorder. So we are a vibrant part of this community, and if you've never experienced a health center visit at a federally qualified health center, there's no better time than today. We are not the age-old Department of Health. We're really like private practice supersized. So if you're new to town, give us a try by calling 257-8224. In addition to being available to fill the gaps in healthcare that exist in our community, we also try through this radio program to fill the knowledge gap of what's going on in our community. We have a lot of great resource partners. We have a lot of folks that we rub elbows with at various functions. And yet the reality is that newspapers are sort of passé. You can only read so much on the internet. And so this is a vibrant way, we believe, of bringing individuals to you so that you learn about their services as well. Again, helping to fill the community gap. So today I have someone who hasn't been with me for a couple of years, Patty, and her new sidekick, Jessica. And so I'm going to turn it over to Jessica to tell you why they're here, what agency they represent, and we'll go from there. How's that sound?
Yeah, sounds great.
Okay.
Thank you so much, Vicki, for this opportunity. Me and Patty are part of the Resource Center for Disability Solutions, and our common goal is to help individuals with disabilities live as independently as they possibly can.
That's a pretty tall order.
Yeah. People with disabilities come close to my heart. I have a brother with autism, so it's something that I've always had a passion for. A lot of these individuals, they struggle with getting the help and things that they need. So if we can be that source for them and we can kind of help them and encourage them to live as independently as possible, that's such an amazing thing. And it's
amazing that we have grown to understand that disabilities doesn't just mean physical disabilities. Mm-hmm. When I was a kid, polio was still rampant. And so my first images of people with disabilities were those who had to have assistive devices for walking because of a polio episode, as it were. And yet today, we have to make our children and our grandchildren even more aware that sometimes you can see the disability and sometimes you can't. And I think as adults, we sometimes forget that. We see someone in a store or outside in a yard, and they get kind of the funny looks. Why are they doing that? So you probably help them with those kinds of things as well, how to get counseling and supportive services? Absolutely,
yeah. We have a lot of information and referral services that we provide. So if we can't do it directly within our core services, we do everything that we can to try to help them get connected to other resources.
That is so important.
Yeah, we try to meet all the barriers that might hinder someone from being more independent with a disability. And we've been very successful with that over the past since 2018 here in Vero Beach.
Well, and you also, when I talked to you last, you had a resource center in Brevard County as well.
Yes, so we're our home office is in Rockledge, Florida.
Okay.
And we cover Brevard County and Indian River County. We're the Indian River County team.
Okay. And your location is where?
At the UP Center, United Against Poverty.
Okay. So if someone wanted to come and see you as opposed to calling you, they could do that Monday through Friday, or is it part-time?
Monday through
Monday
Friday.
through Friday.
Yes.
Awesome.
8:30 to 5 o'clock.
Room 208.
Okay, so if you're there, so's Treasure Coast. So,
Yeah.
and it is a wonderful one-stop shopping
It
for all
is.
the different types of things that an individual might be looking for in this community in
Yes.
the way of assistance.
Absolutely.
Their members share grocery. I know that the hospital district has the Globe Check there every couple of weeks
Yes,
now
I see them.
to do free eye screenings. You guys are there. DCF is there.
Yeah.
So it's a wonderful thing that they've built. So tell me about your core services you mentioned.
Yeah, so we have, like I said, information and referral. We have our home modifications program. We got recently a grant for that. So we've been helping a lot of individuals try to, whether it's ramps, shower chairs,
Grab bars.
Yeah, things
Yeah,
like
that's a
that.
big thing for someone who lives by themselves.
Absolutely.
yeah.
And if we can help with, not putting them in an assisted living facility and they can stay in the comfort of their home.
Safely.
Yeah, we support that 100%. So,
And so is there a fee usually for things like installing the grab bars?
our services are completely free.
Completely
we are
free.
wait list based.
Okay.
So that's the only thing. We just put them on the wait list. But once they're at the top of that wait list, all the services that we provide are for free.
That's wonderful.
We have federal and state funding for our
Yes.
programs.
And so you hire licensed independent
Yes.
contractors that will come out to the homes?
Mhm.
That's great,
Yep.
because you never know what you're going to get unless you go
That's
through
true. That's true.
an approval process like you have.
ADA is, we follow all the rules for ADA and compliances and things like that. Yeah.
Okay. So I think we got to number 3,
Yes.
and I detoured you.
Yeah.
Let's keep going.
So we have independent living skills training. So it could be anything from money management to learning how to cook simple meals to, maybe getting a driver's license. Patty, I don't know if you want to piggyback off of that.
I helped a lovely young man with autism go through the driving book, and took 4 times before he passed the test. But they were wonderful up at the tax collector's office. That's where they have to take the test, with reasonable accommodations for my young man, and it was a big success. And,
Very nice.
And he's driving now, and it's awesome.
That is awesome, because without mobility, it's just very difficult to be independent.
Mhm.
Absolutely.
Yeah.
Absolutely.
So good for you, Patty.
Thank you.
Yeah. So that's sort of the not in the brochure kind of thing.
But it's the effort that we put in. We are very serious about what we do. And I've been working with folks with disabilities for 30 years, so it's very dear to my heart.
Mm-hmm.
And we like to see success with our folks. There's nothing like a big smile on your face and high five.
Absolutely. That's great.
Yeah, with somebody that I'm working with, she is a young lady. She's probably a few years maybe older than me, but she's amazing. She went through a lot of difficulties recently in her life, and she needs to kind of focus on the self-care aspect of her life. So I've been able to work with her through journaling and meditation and things like that to kind of, recharge herself and make sure that she's focusing on herself so that she can be better in all the other aspects of her life. And every time she comes into the office, it's like the biggest smile on her face. She gives me a hug. She tells me how much, how appreciative she is that we are able to help her. And
Yeah,
things
you're
like that.
recharging batteries, it sounds like. That is wonderful.
Yeah.
Did I hit all 5? Did you hit all 5?
I did not.
Okay.
Got a couple more.
Okay.
Yes. So we also have durable medical equipment. So not in our Vero Beach office. We do have it in Rockledge. So we offer durable medical equipment if anybody needs it. Again, it's also a wait list type situation. But once they get that at no cost.
Okay.
So that's very beneficial, believe it or not. And then we have advocacy. So we do a lot of advocacy. If something we see, in the job force or at schools and things like that, if we see something's not just within our disabled community, we're able to kind of be that extra push for them and kind of give them that support that they need.
And systems advocacy.
Yes.
Yeah. We do IEPs in the school system also. We advocate for that. Our supervisor is ADA certified. And so we have all kinds of resources to help whatever it needs to make the person life better
Easier.
in school,
Mhm.
anything to do with disabilities. Yeah.
And so sometimes it's not a thing, as you said, it's a system, it's a process.
That's it. Yes.
Something that allows them to get from here to there in an easier fashion. And it might be, something that they push for stability, or seated if they get tired, but it also could be just as simple as going from one classroom to another without all the crowd.
Yes, to make their learning experience more successful for them. I did want to mention, too, that we're celebrating our 48 years.
Wow.
1975, we were the first SIL in Florida.
That's amazing.
And so we're very proud of that. Yeah.
I guess so.
Yeah.
And if a family member wanted to reach out and contact you just to talk about, what kinds of things you might be able to offer, is that okay? Or do you have to deal directly with the client?
No, the family also.
Yeah,
yes.
absolutely.
Because sometimes the family's like, well, I don't know what to do with my child. I don't know what to do with my mother. She shouldn't be driving anymore.
One day that'll be me.
So any questions? We have so much knowledge. I'm very proud of that. We can find an answer to just about anything that it has to do with a disability.
That's awesome. So I'm going to take a short break, but before I do that, I want to tell people, grab a pen and pencil, because when we come back from our short break for our sponsors, we're going to make sure that you have the phone number and the address. You can write this down. Okay? So be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Sunshine Furniture brightens up your day.
At Sunshine Furniture, we've been the outdoor furniture experts for over 30 years and carry the largest selection of patio furniture, all made in America. Hundreds of styles, colors, and fabrics to choose from in outdoor wicker, aluminum, and recycled plastic from Lloyd Flanders, Hollywood, Berlin Gardens, O.W. Lee, Windward, Woodard, Telescope, and others, all made to withstand our Florida climate, in stock and ready for you to enjoy. Right now, we're having a spring sale on selected groups, and also all pictures, lamps, and accessories are half price. We also specialize in replacement cushions, umbrellas, beach chairs, outdoor rugs, and fire pits. Sunshine Furniture, 1295 US 1, Vero Beach, next to Planet Fitness. Visit our website at sunshinefurniturecasual.com.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine.
For those tired of staring at laundry as it piles up, the answer is usually putting it off as long as possible. For most, there's not just another minute to squeeze into a day to get the laundry done. Sunshine Laundries can help. This is Tom Rhodes, owner of Sunshine Laundries, with a reminder that 5 of our locations offer drop-off service. We'll wash, dry, and fold. For locations and hours, we're at sunshinelaundries.com, and with laundromats all along the Treasure Coast.
And welcome back to Community Conversations. If you're just joining me, my name is Vicki Soule, and I'm happy to be here every week, bringing new people and sometimes experienced people that we haven't seen in a while, like Patty, back to us so that you can get updates on what they're doing, how they're doing it, how they can help you, filling the gaps, as Patty just commented to me during the break. The wonderful thing about Indian River County is that we not only stay here a long time, her organization, you said, is how many years old?
It's celebrating 48 years.
That's amazing. I can't count that.
We
large.
were the first SIL in Florida.
And SIL is?
Centers for Independent Living.
Aha. Okay. Sorry. We all use acronyms, but we don't all know others' acronyms.
Yeah.
So one of the things that we talked about before the break was being able to contact them for a consult or anything else. Again, because we know that transportation and crowded schedules and all the rest of those things sometimes act as barriers, whereas a simple phone call works really well. So, Jessica, what's your phone number?
So for our Vero Beach office, it's going to be 772-774-3060. My direct extension is 102, and Patty's is 101.
201.
201?
Yeah.
201.
And I'm 202. I'm sorry.
Okay. Well, again, they are both here at the Unite Against Poverty building Monday through Friday. So right here locally in Vero. But again, if you, these guys have got so much experience, you know, if you have a question and, you know, you keep putting off going to see them, give them a call. They're very, very helpful. So I was going to ask you, you have started a support, well, maybe not you personally, but your organization now has a support group for TBI, traumatic brain injury people?
We do. I worked with some of the folks individually in independent living skills training, some of the TBI folks, and I was invited to one of the support. The support group used to be at the Encompass Healthcare Center. Now it's at the Up Center. It's the first Wednesday of the month, and we are getting more people all the time. They come to the support group and they benefit from exchanging stories, exchanging ideas, and things that have helped them out in the community to become more independent.
And to be honest, it's probably a great social outing if you're in charge of it.
It is. It's very nice. We have a lot of fun too. Yes.
So do they they don't need to make an appointment or tell you they're coming? Or?
They need to call, and then I'll connect them with the mom that gets the list going and things like that. Yeah. Yeah.
So again, Jessica, the phone number is
772-774-3060. I'm extension 202, and Patty is 201.
Yeah.
Okay. So again, that's a really rare opportunity for folks to get together, and so I think that's a wonderful thing. But you said it sprung out of the independent teaching that you do. So is that an individual or a small group class?
No, it's an individual. That's the key. It's individual training per that person's disability, their cognitive skills, things like that. It's much more effective than in a group because it's geared to that particular person's needs.
And I would imagine you vary the length of time based on that ability of that individual.
That's correct.
Yeah.
That's correct.
And it's free.
It's free.
Everything's
free.
I love it when I can say it's free. Well, actually, it's not free. As taxpayers, I guess it must flow through the federal and state grants, but it's for the independent family, it's free, and that's a wonderful thing. Yeah. So thank you for all you're doing there. Now, Jessica, you said that there were some other things that you wanted to tell us about. Starting with transitioning?
Yes.
So
that I guess is another core service that we provide. We do a lot of efforts with whether it's people transitioning out of the hospital, transitioning out of different types of facilities, like maybe the prisons and things like that. A lot of times they don't know how to go back out into the community, and they have to kind of start all over again. So we do have an individual on our team that primarily focuses on those services.
Wow.
So
that's so we're going to have a follow-up a little bit later. Because, Treasure Coast Community Health has been providing medical and behavioral health services at our local jail, and that's one of our goals, is to make that transition easier for people.
Yeah.
Our staff there are doing a great job. I had someone stop me there and say, "Don't let them release me. The best health care I've ever had in my life is here." And I'm like, I'm not in charge of that. But thank you for the compliments to our staff.
That's awesome.
Truly, they're very caring, compassionate, but smart nurses and therapists. So very, very happy to be able to take care of folks there. Because for most of us, it's a moment in time that causes us to do something we shouldn't, and then bam,
Affects your life. Right?
it really does affect your life. But it can be viewed as a new start too. It's sort of a line in the sand. So I wanted to ask you very quickly, though, when you talk about disabilities and discharging from hospitals, I think because, again, we have so many folks in our population that are struggling with diabetes, and unfortunately, some of them have amputations. They might have gotten an infection in their foot, not realized it because they lose their sensations in their feet, and sometimes the ultimate happens. Would they be considered disabled for use of your services?
Absolutely.
Okay.
Yeah.
As I'm not on the up and up in terms of what the disability by law is, but I get the feeling you welcome it all, that there's no barriers
Yes,
to
no matter what
take care of.
age. Yeah. They have a disability, we're able to help them.
So that flips the equation around a little bit for me. I will see young parents coming in with 2, 3, 4-year-olds, and they're struggling in terms of, could my child be autistic? So if they had that question and came to you, you would give them resources to figure that out?
Absolutely, yeah.
Yes.
Again, it goes back to our information and referral services. We try to connect them to the appropriate services that they need.
Okay. So what else can you tell us in the next 3 minutes?
So
no pressure here. Yeah. You're doing great.
Thank you. We provide peer support. So a lot of times too, individuals will just walk in and maybe they're just having a bad day. They're just, it's a lot. They need someone to talk to. They may not have people around to talk to. So we try to also be those individuals that has a listening ear for them. And it really does make a difference for them. They walk out of the office more, I guess, clear in their mind.
And they see another perspective.
Exactly.
Yeah, and we're always on the positive side, never on the negative. Negative is not allowed in our office.
I was going to say, I don't think, Patty, you've ever said anything negative that I've known you a long time, and you're one of the most positive people I know. And Jessica can't stop smiling, so I know you got a comrade here. Yes, absolutely. Yes. So again, audience members, I'm so glad to have been able to bring these two to you today, and I can't say enough about how congenial they are in assisting, whether it's in the school system, whether it's in your family life. They're here for you. So any last words?
No, we enjoy working.
Do you have a website?
We do.
Okay.
It is rcdsfl.org.
RCDS, which stands for Research
Center for Disability Solutions.
All right. Very good. So we're just about wrapped up. I want to give the phone number one more time because I know, while a lot of us use our phones for texting, it's still phone. It's still very valuable that way.
Yes.
So last time around.
Yes. So the number is going to be 772-774-3060. My extension is 202 and Patty's is 201.
And Jessica, just how long have you been with them? It seems so natural the way you talk about this.
I've been with the organization for about 7 months now.
Wow. I wouldn't have guessed that. I'd have thought a lot longer.
We share an office, so she's my best trainee ever. She hears from me just about every day because we go over situations also. Every situation is different. And she's a sponge, so, it works out really well.
And she has so much wisdom, and this is like my first big girl job. So it's very nice to have, I see her as a mentor and a very big role model for me. So it's really nice to hear a lot of the wisdom and just her outlook on life. It really inspires me to be my very best. So.
Well, I wish I had thought to ask it sooner because we're wrapping up now, but if anybody wants to know how you can become the next Miss Jessica, give her a call for that too, because we need more people in the social services arena to help us. Okay, so your phone will be ringing. Thank you so much for being with us to the very end, and I hope that you'll dial in again next week on Saturday at 4:30 for another wonderful guest of mine. Thank you. Bye-bye.